follow-up on coverage. You were saying that people, if they can't get access to insurance, they don't have coverage. But
right.
If you remove the individual mandate, you are going to have people who are not going to buy coverage. They're not going to buy insurance. And so, getting back to the Congressional Budget Office score, would you concede that there will be some coverage losses, perhaps in the millions? That there will be millions of people who will not have health insurance as a result of what you're doing?
Well, again, sure, except you have to look at the current situation. You are mandated by law to buy insurance right now under Obamacare. 13+ million people have asked for a hardship exemption, and then 6.5+ million people have determined to pay the penalty. So currently, if we look at the universe and say it's roughly 30 million people, only 9 million people engaged in the exchanges when required by law. The majority, almost 2/3, if my back of the envelope math is right, about 2/3 have chosen to either apply for a hardship exemption or pay a penalty. So
the mandate forces people to buy insurance, and if they don't have insurance, then you have the free rider problem in the system.
Right, but look at what's happening now.
So you have free riders, and those folks
no, because the current
show up at the emergency room, and then the health care is much more expensive.
They do it right now. But my point, Jim, is that the way the system was constructed under Obamacare, they've created the system to force people to buy plans that they did not like, that were mandated by the government in terms of what was part of the plan, what it had to cover, the deductible, et cetera, et cetera. And yet, roughly 2/3 of the people either paid a penalty or asked for a hardship exemption. They didn't do it. And so the idea is, actually, if you could bring down cost and choices and allow people to find a plan that fit their budget, that was tailored to their needs, there's actually a higher likelihood that they will find something that they want at a price that they can afford, as to right now, which is, I get a plan that I'm forced to buy that has a deductible that I can't afford, but I've got a cute little plastic card that I can wave around.
This will get you coverage.
No, that's not true.
You show up at the emergency room, if you've been hit by a bus,
sure,
you're not going to be just paying out of pocket to the hospital.
But under any scenario,
you have some sort of catastrophic coverage that will make sure you have insurance.
Thank you. That's a great advertisement for thank you.
But
that's exactly what the president's trying to do, because right now you've got, of the attempt to get 30 million people covered, 14.5 million people applied for a hardship exam. They're exactly the people that you're talking about. Another 6.5 million people have paid the penalty and don't have it. So we have roughly 20 million people in this country who were supposed to be required to buy health care, that have chosen not to do it, who fall in exactly to the category that you're talking about. The question...
But that's
that
number is massive by the year 2026.
Right, and so the point that I'm
getting,
hold on,
Americans.
But if they actually had choices and had a plan option that was down at a budget they could afford, there is a higher likelihood that they would buy a plan that was A, tailored to them, and B, actually that they could afford. So to your question about catastrophic, right now that's in most cases not even an option. In 1/3 of all the counties in the United States, they only have one choice. In 5 states, they have one choice. Can you imagine if they could actually buy a plan?
That talking point, but at least
not a
there's
talking
coverage
point.
in those states.
No, it means right. And in a lot of,
if you pull this away, then you're going to have people in a lot of states who aren't going to have access to coverage.
That's not totally
because
false.
they can't afford it with these tax credits you're providing.
That is
an argument to the other
no, there's
side
not.
of it.
No, actually, I don't. You've got 175 million Americans that get their insurance through their employer, and frankly, right now, they're the ones who keep paying higher and higher premiums because a system that was only supposed to help people get access and require them get a government mandated, government run health care has actually gone amok. And so right now,
government-run healthcare, Medicare is government-run.
Right, and what's happening?
Citizens
and more and more.
That they
do.
want you to get rid of their Medicare.
I think you need to maybe get outside and talk to some of them, because more and more Medicaid recipients, in fact, more and more Medicare recipients, aren't actually able to get coverage. Again, it's one thing to have a card. It's another thing to walk into a doctor's office and them to tell you, we no longer accept Medicaid anymore. That's not care.
But the president's okay with.
No, he's not.
There are going to be millions of people who aren't.
The president's goal is to provide health care coverage to every American, and right now they're not getting that. And by giving them more choices at a lower cost, more Americans can either buy health care for their family or themselves, or in a lot of cases for their business, without paying the penalty. Which is what a lot of them are doing, or forcing people into exchanges that have fewer and fewer choices. The system now is not working. The costs are going up, the choices are going down, and deductibles are going up. That is not an option. And for every American, and I mentioned this earlier, that to make this look like a choice, there isn't really a choice. The system that we have now is failing. The choice is whether we give them an opportunity to have real care, and in a way that is tailored to them in their budget. Julie.
Thanks, Sean. You said earlier that the White House doesn't have projections on how many people will lose coverage of its own. Is that a projection that hasn't been made yet, or are you saying that the White House is not going to come out with this?
We don't. That's not something that OMB does.
So, but if you're advocating for a plan that you say the president wants to cover everyone, how are you going to be able to assess whether you've been successful if you're not going to project that yourself and CBO's projections you're saying are invalid?
Well, I think that if you look at what the goal is, which is to make health care available to every American. As I said, I mean, you have a choice right now that's either we support a failing system, that there is no choice and that the premiums are going up, or you provide them with the system that we're looking at. I think in most cases, of course, some people are always going to choose in a free society to not purchase something. I mean, we live in a country of 320 million people. At some point, you can't force a product or a good down people in a free society. But I think if you can give them a quality product that serves their needs that they have at the time at a price that they can afford, there's a greater likelihood under every economic model that suggests that will work. So I think it's frankly economics 101 and basic common sense that dictate that the more competition and the more choice that we institute in the system, the greater likelihood of more and more Americans getting health care is something that is easy.
Apologies if you did, I want to clarify. Can you stand here today and say that the president will keep his promise of insurance for everybody?
I think the president's goal is to provide insurance, to make insurance available to everybody. Yes, that's what he intends to do. I think that is the goal of this, is to make sure that every American has the choice and affordability and a plan that they can afford, and that they have the choice to buy. And that's not what they have now.